Mr. Chairman, it is tragic that we are now actually finally debating health care in this committee, and most of my Democrat colleagues have left. I am particularly saddened that now that we're getting down to the merits of this debate, Lois Capps has left because she asked about pre-existing conditions. Every single Republican bill addresses pre-existing conditions. My bill does, Paul Ryan's bill, Tom Price's bill, every Republican bill on the House or Senate side addresses pre-existing conditions and says every American would be covered, every American would be assured they must be issued a policy, and says that their policy could not cost more than 120% of the cost for a person who did not have that pre-existing condition. I have an older sister who's a breast cancer survivor. Do you think I don't want her covered? Every Republican bill has universal coverage. Where we disagree is on cost control. But most importantly, we disagree about the outrage in this bill. There are two things in this bill which cannot be morally defended. They are that, number one, the bill does nothing about the fact that health care policy in America today punishes the poorest Americans. How can my Democrat colleagues defend that? How does it punish them? It says that if you're lucky enough to get employer-provided care, it's tax-free. But if you're poor and you work for an employer that doesn't offer you employer-provided care, you lose. You lose. Tough luck. Suck it up. You got to buy it with after-tax dollars. That's just morally wrong, and I've been fighting it since 1995. The second outrage in this bill is an odd one, because my Democrat colleagues fought this outrage back when we had the Patient's Bill of Rights. Current law in America says that if an employer-provided, ERISA-governed plan injures or kills you, they're immune from damages. They pay zero. Democrats wanted to fix that when we were doing the Patient's Bill of Rights. In this bill 3200, extends that immunity. Mrs. Corcoran's baby is dead, and the Corcorans lose. That's not morally defensible.